Hello everyone. I am drberkkkaratas. We are with the fourth video of the Chalkboard series. I will share some information about sexuality. Of course, one of the most important points here is sexual information. First of all, sexuality, that is, an action. We need to have information about that action while doing that action. Yes, we are all genetically burdened with some things, but it is not right to continue with these alone. Because sex is no longer done just for reproduction, as it used to be. At the same time, we need to know some sexual information clearly, as it is done for pleasure and pleasure. Now, first of all, let me say that there is no information about sexuality that says this is normal, you should do this. So there are some expectations of medicine in sexuality. But normals vary from person to person, from couple to couple. I'll give an example of what happened a little later. That's why our recommendation to couples, that is, our recommendation to couples who come to have sexual intercourse. Our first suggestion is this: if you're happy, move on. In other words, if your action does not harm you and the other party, if it is within the framework of medical rules, continue whatever you are doing. You don't need to let it go. And one of the most important points is to communicate. In other words, couples need to communicate with each other sexually. After all, this action is done between two people and is based on giving pleasure and receiving pleasure. Therefore, here too, you need to know the characteristics or wishes of the person you will give pleasure to. That's why sexual communication is so important. Now this sexual cycle, by the way, before we continue, there is a video about each of them on the YouTube channel. Fantasies, foreplay, lovemaking, differences between men and women, position, types of orgasms, process, frequency, we have separate videos about all of them. Those who are curious can also watch them. I'm going to summarize in general, I'm going to wrap up. Now the most important point is that men and women have a number of differences. I'll talk about it a little later, but their sexual cycles are different from each other. In men, normally a man comes and his sexual desire increases at work, and the sexual desire of the man usually increases suddenly. That's why we say that men burn like light bulbs, women are radiators, their desires increase over time. Men increase their desire, come and get pleasure in the penis vagina or in another way, then it ejaculates and male desire drops to zero. This is very important. Males always fall to zero, that is, return to their initial state. But women also rise a little later, have an orgasm. Women do not immediately fall to zero, as you can see, as in men. It remains a little during this period. If enough stimulation comes and the stimulus comes again, they can have an orgasm again. This cycle can actually technically go on forever, theoretically. But normally, of course, such a thing is not possible, but they can orgasm several times in a row. This is also the main difference in the sexual cycle between men and women. Now what's the other difference? First of all, what women perceive from sexuality is very different from what men perceive from sexuality. So we need to know this as a man or as a woman. Now there are three important points of sexuality for men. It's very important to be dominated and appreciated. In other words, men do this in order to gain superiority over the other party in sexuality, to show their power to the other party, to gain the admiration and appreciation of the other party, and to make the other party happy. In women, sexuality is not exactly like this. That's what I always say. I say to men, see, what you lift your penis and insert into the vagina is not actually your penis. This is your love and the perception that you like it. Women perceive that they are liked and desired in the relationship. In other words, when you have a relationship with a woman, that woman perceives it like this. This man likes and desires me. If you don't have intercourse for a day, that is, if the time is extended, the first question she will ask you is, do you not like me? Don't you desire me anymore? If you continue not to have intercourse, the second question comes. Are you cheating on me? Why? Because that's how a woman thinks about her brain. If he doesn't like me, if he doesn't desire me, he desires someone else. That's a question mark in return. The question becomes, are you cheating on me? Men are like light bulbs, as I just said. They burn in an instant. Desire for the breed can also increase very quickly. Women, on the other hand, burn slowly like a radiator. Men may or may not have emotional relationships. In other words, a man can have a relationship without establishing an emotional relationship with the other party, but this is not possible for women. Of course, I want to say here, in this general sense, that is, if you are not like that, yes, we cannot say that men are not like that. Studies say that most men and women are like this. Men are slightly more prone to polygamy. Women are in favor of monogamy. This is very important. We said get in touch. Men say that they can get into sexual marriage very easily. They say, I want to have sexual intercourse. But he doesn't really go on. In other words, they make superficial conversations. Women, on the other hand, can have very detailed conversations if you start talking about sex. Your fantasies can tell you a lot of detail. We don't see this much in men. Quantity is important in men, quality is important in women. Not at all. Now men are more concerned with the score like this, they deal with the number. I had intercourse 5 times in one night. Here I came and went in the vagina for an hour. They say I've been with 5 women. The women, on the other hand, describe the nature of this work. We had a romantic dinner at 5 p.m. He gave me little touches. He received a nice gift. Then they say we had intercourse. Here it already follows the following conclusion. In fact, it's about quantity. Men love to exaggerate. I always say, for example, if a man says, and he says I ejaculated 7 times a night, you can divide him by 2. At least 3 is 4. In women, there is less exaggeration. Women actually like to tell more about the pre-relationship. That's what happens in these movies, that's what happens in normal life. You know, when they talk about it like this, they say that we had a romantic meal and then laugh. In other words, they do not tell that part much in general, and even if they do not exaggerate. In other words, if a woman says she has had intercourse twice, it may be 4, and in the case of a man, it may be this number. Yes, the differences between men and women, these are the main differences after the sexual cycle. Now a question should be, what should be the duration of sex? There is also a lot of curiosity about this. Of course, I said that there is no normal in this business. But medicine has an expectation. So if a person says 2 couples, sir, we make love for an hour. That's how we play kissing and so on. Then, if the penis goes in the vagina for half an hour, if they are happy, it is not a problem for us. It can also be the other way around. If this job is done in 5 minutes like this, if both parties are happy, it's okay. But here's what we expect. That lovemaking part, foreplay and lovemaking are very different from each other, which I will explain a little later. We have a medical expectation that this part of lovemaking will be around 15 minutes, that pleasure will peak and that ejaculation and falling will be around 5 minutes. So we can say that 15 plus 5 is medically normal for a period of about 20 minutes. Frequency is also a very important point. Now, in studies conducted around the world, we see that 44% of couples between the ages of 20 and 40 have intercourse once a week or more. We know that 56% of them, especially at a young age, have far fewer relationships per week and more. Of course, this frequency depends on 2 things. It actually depends on 3 things. 1, it depends on the status of the couples. In other words, you can have intercourse with someone you are with for the first time in your life 2, 3, 4 times in one night. Secondly, it also depends on the duration of your relationship. So if you've been in a relationship for 10 years, let's say you're 40 years old, you've been married for 10 to 15 years. Here, 2, 3, 4 intercourses every night will no longer be possible. The age of the person, of course, decreases as the age progresses, and the age of intercourse is very important. I mean, you have 2 18-year-old couples, 2 19-year-old couples, after you have an orgasm, the man has dropped to the 0 point, or it can come back in 30 seconds. This break can be 30 seconds, but this break, for example, at the age of 50, can happen in 4 days in 20 years of marriage. In other words, it can happen in 30 seconds, it can happen in 4 days, it can happen even further in 10 days. Now here's not a lot of importance to how often it is. If the other two parties are happy, there is no problem. But our goal, for example, is 2 this week between the ages of 20 to 40. For example, in the 50s, we have a medical expectation once a week in 20-year marriages, in the 60s, every 10 days, every 15 days. That expectation must be followed. For example, at the age of 50, in a 20-year marriage, I want to have intercourse every day. At the age of 20, I used to have intercourse every day, I want to enter again. Since this is not a medical expectation, we do not treat it. I mean, sometimes patients like this come in, I want to have intercourse every day. Unfortunately, there is no medical treatment for this. Now again, position information, we have good videos about it on YouTube, I recommend you to watch it. I made a video specifically called this 1 million crazy positions, which is very important. The position also changes from person to person. The important thing is how happy you are in which position. You can do the position you are happy with for the rest of your life, no problem. But when you're doing positions, especially when watching these erotic or porn films, the women and men there can do all kinds of positions, and sometimes they try to imitate them. There are 2 important points when positioning. First, or rather, there are actually 3 important points. First, do you know the position? I mean, do you know where to put your hands and feet while you're doing that position? That's the first one. Do you know the shape of the position with the diagram? Second, is this position physically suitable for you on the other side? In other words, when a 70-kilogram woman and a 70-kilogram man are together, it is not possible for the man to take the lady in his arms and do her in that position. Therefore, physical harmony is very important here. Also, penis-vagina harmony is important. The author of the Vatsyayana, or Kama Sutra, has mentioned 20 such sexual positions in his book. Vatsyayana did not say hundreds of positions, as one might think, they were invented later. The purpose of his saying those 20 positions was this. Here is the big man, here is the rabbit man, etc. This must be the way a big man and a petite lady combine. And there he was saying, the depth and breadth of the vagina is with the big one or the big one and the big one with the penis big and the small one. In other words, your position is very related to the size and smallness of the penis, the size of the vagina of the woman in the same way, your physical rules and your knowledge of the position. Therefore, we need to pay attention to the positions in this sense. Now the type of orgasm is very important. It's actually about communication. So, of course, men's orgasms happen in one way. It happens that the penis somehow goes back and forth in oral sex, masturbation, and vagina. But ladies have clitoral orgasms, vaginal orgasms, G-spot orgasms, etc. Either way, it is very important to know the type of orgasm of your partner here. Because if a woman only has a clitoral orgasm, then, of course, except for some positions in the vagina, she will not be able to reach a certain satisfaction, no matter how much you go back and forth in the vagina. In the same way, if she can only have a vaginal orgasm, that is, if she can have an orgasm since going back and forth into the vagina, then, for example, oral sex will take very little of her clitoral area, but it will not give her that satisfaction. It is also very important to know this because positions also change here. For example, women who have clitoral orgasm usually take the penis inside the penis and spring it back and forth in the upper position, rather than in the form of the penis going in and out of the vagina. But if the same woman, that is, another woman, has a vaginal orgasm, then she will move up and down. This is also important, especially in position choices, and it is necessary to know in which way your spouse enjoys a person that you would normally give pleasure to. Again, it comes down to communication. Fantasies are very important. When you think of fantasy, handcuffs and so on immediately come to mind. Fantasy doesn't just mean that. The topic comes back to communication during the relationship of both parties. You need to know what you want during the relationship. Maybe your partner doesn't like it when you touch her breasts while you're going back and forth, or she likes it a lot. He wants you to do it, but he doesn't tell you. This is also a fantasy, for example, or I don't know what else, she wants his hands tied, for example. A very simple, innocent request, or wanting to close your eyes, etc., can all be considered fantasy. Fantasies are so strong that if they are not done, many things such as erectile dysfunction, inability to enjoy sexuality or beauty will happen to the person. If fantasies are doable, but fantasies can be done, of course, your fantasies can be done, be sure to contact your partner and tell them. You will enjoy the relationship much more. Yes, our last topic is foreplay and swearing. I attach great importance to this, because the foreplay we know here is not actually foreplay. So what do we say? Here I had a good foreplay. You lie on the bed, kissing, playfulness, oral sex, masturbation, we call it foreplay. No, it's not foreplay, it's lovemaking. In other words, we call it lovemaking when we get together with a lady and start kissing in the sexual act, the sexual intimacy starts and will continue. Foreplay is a very different thing. We have a video about foreplay, such as having a romantic meal together, buying her a gift, whispering something romantic in her ear at work. I recommend you watch it as well. That's what foreplay means. As soon as you get into bed, lovemaking begins. Lovemaking, as we know it, is not the only way. Generally, the subject that Turkish men enter is this: kiss, lift, lift and shove. Now we have a video here about it. Now, what we understand by relationship is kissing, playing and getting in every time. Now it is a bit stressful for the penis to enter the vagina every time. In other words, it can create stress in men and women. There is such a thing in the relationship anyway. We shouldn't set goals. In other words, it is necessary to let the relationship flow. Again, the author of the book of the Kama Sutra says to Vasayan, know what you know. Whatever the other people know. No matter how beautiful or ugly it is, every relationship has its own rhythm and you have to keep up with that rhythm. He said that if you don't keep up with that rhythm, you're going to have problems. That's why we can make love in 4 ways, and it is necessary to repeat this from time to time. Because every time, the goal of the penis to enter the vagina can create some problems. For example, the first one is kissing and playing. It's called flirting, but it's not flirting, it's actually kissing. In what we call kissing playing, for example, don't squeeze your spouse while eating. In fact, we can say that it is a click ahead of a kind of foreplay. Kissing, playing and stopping. What would this be? It allows you to increase your current sexual desire. Therefore, we can enter the next relationship much more easily. One-sided masturbation, what would it be? For example, one of the spouses is very sexually enthusiastic that day, one of them is not. You ask your partner. It is said that I am very sexually destined, I want to have an orgasm. What happens then? One-sided masturbation or oral sex. Oral sex is also a form of masturbation. Oral sex can be performed. This can also be used to increase sexual desire. Because there is the issue of prey hunters. I explained this in my videos. If the hunter catches his prey all the time, there is no joy in this business. Every once in a while, he has to miss. That's why they say it's so enjoyable to hunt. This is one such issue. Don't go to the destination all the time, let it go. Not doing it intentionally and willingly is something that increases much more sexual desire. So you may not be able to do it because one party doesn't want to. But if you don't do something when you can, it can increase your sexual desire even more. In the same way, there can be two-sided masturbation, that is, two-sided sex. This is also a form of intercourse and finally is a penis intercourse. I say, for example, do you have 10 relationships a month? Let's say 10 relationships a month, right? Well, that foreplay should always be practiced from time to time. For example, in 5 of them, yes, use penis-vagina intercourse. For example, in 3 of them, one-sided intercourse. That is, let it be one-sided. Let me do this on the 3rd, sorry, use this on the 5th, use this on the 3rd, use this on the 2. Do this in 1. So do it repeating it over and over again. What happens then? Since the penis-vagina is not focused every time, it is much more enjoyable. There may also be a matter of hunters, a matter of chasing. Therefore, it is necessary to use all of these methods here. Then, if we include our relationships, our fantasies, if we have sexual knowledge, if we communicate, if we respect our cycle and frequency, if we respect our age, if we know the differences between men and women, we can be much more successful sexually in our long-term relationships. Thank you.